topic for today is GABA, now over the counter. And I put that in quotes because when I suggested this topic was when I was first, not long after I had first been alerted to GABA supplements being over the counter. As I did some digging, yeah, this has been around for a little bit longer than I was aware of. So we'll keep that in quotations because I'm just knowing it's over the counter. So I'm going to share that with you. And maybe you're better informed than I am. So my objectives for our talk today, which I'm going to try to keep super brief, is to describe the pharmacology of GABA. So why would we even want to use it? What could it be working for? And then what are some of the concerns about having this as a supplement that's available a little bit more in a widespread manner? Are there any concerns? So I guess that was a total spoiler that the answer to that is yes. So gamma-aminobutyric acid, GABA, is our main inhibitory neurotransmitter in the central nervous system. So it acts on a couple different receptors, GABA-A being our chloride ion, causing hyperpolarization. So we're not going to get neuronal firing, and that really changes the signaling of a number of different neuronal pathways. So there are some pathways that are specific to GABA, areas such as attention, concentration, as well as some of our motor pathways are specifically driven by the GABA system, and any interference with GABA here, either increasing the amount or decreasing its activity, could have an impact there. But GABA also plays a role that we're starting to understand a little bit better in a number of other neurotransmitter systems. Serotonin, norepinephrine, GABA, it is GABA, serotonin, norepinephrine, dopamine, and glutamine. So it appears to be involved in a number of other processes outside of what was traditionally thought of. It may play a role with anxiety and depression. It may play a role in some psychosis, as well as in bipolar disorder. So we really see it being a little bit more ubiquitous than just specific cut and dry areas such as epilepsy or muscle spasms and things like that. So with that in mind, some of the specific symptoms that have been identified and related to GABA supplementation intentionally are anxiety, muscle tone and muscle spasticity, sedation, mood stabilization, and epilepsy. Related to those, we have a lot of different prescription medication classes that have actions that are related to GABA. And here are just some examples, with benzodiazepines, flumazenil kind of being on the same receptor but different sides. So as you can see, we have a number of anesthetics. I didn't even mention that before. So we have a number of different prescription medication classes that relate to GABA. So it really shouldn't be a surprise that there is a look to enhance this particular system. Of these agents, none of them are GABA specific. None of them work as GABA, try to mimic GABA. They all are doing something different, whether it's activity on the receptors to enhance the activity of the receptor, to block the activity of the receptor. It could potentially be as an allosteric modulator. So we've got the benzos and the barbiturates here. So they're gonna attach to those receptors and amplify the response of GABA itself. We have some messaging and transporter agents, so targeting all around GABA, the neurotransmitter itself, but nothing that was specific to GABA. So our prescription products aren't doing what this supplement is supposed to do, which I found interesting. So then I looked, I was like, all right, so GABA is the supplement that's out there. For the most part, they are all using GABA itself. There are a couple other formulations that are slightly different chemical compounds. They have just different features that are added. Some of them have hydroxyl groups, some of them added different carboxy groups, some of them add different salts to it, but essentially most of them really are GABA itself. It's available in so many different formulations. I tried to do a general search for it, and I came up with all kinds of different pictures. These are just some of the supplements that I found that are available. They're available in stores, in pharmacies. They're available even more ubiquitously online. There's a number of compounds, one we'll talk about a little bit later, that had originally been available in Russia that now can be purchased here in the United States online. So it was, my grandiose intent was, hey, let's just put a table together of everything that is available so you can see. Yeah, that couldn't happen because there were hundreds of different formulations and concentrations. For the most part, most of them are GABA specific or have just a small derivation from it. And the vast majority of them are right around 500 milligrams, 100, 250. There were some that were even less than that. 5, 10, I saw 25, 35, 50, but most of them were about the 250 to 1,000 milligram range. So significant differences in how much GABA is being labeled in each of the products, as well as what their recommendations are for dosages. Even those that are 500 milligrams, some of the products recommend that their supplement be taken 3, 4, 5 times daily. Some of them as often as every few hours as needed for the patient. And I wondered, so GABA makes me nervous. It makes me think of barbiturates and benzodiazepines and potential for toxicity and withdrawal seizures. And my head was getting really carried away as I started looking at this. And I was like, how is it that we're not doing anything related to this? Like from an education standpoint, from an awareness standpoint. And the caveat or loophole is because they're listed as dietary supplements. GABA is an GABA is an amino acid. Amino acids are one of the components that can be labeled as a dietary supplement. Therefore, these all fall under this category. And as a dietary supplement, they're not required to provide evidence of efficacy as long as they're not specifically claiming any potential benefit. And I say that with an asterisk. They've found ways to kind of get around that. Relaxation support. So I'm not saying it causes relaxation. I'm saying it supports relaxation as a mood booster. So promoting positive mood and calm feelings of stress. So they're able to really manipulate that, that aspect to be able to suggest a benefit without having to prove the efficacy or to demonstrate safety. Then I was thinking dietary supplement. So this is an amino acid. Are there other things that contain GABA? There are a whole bunch. Oh, and that's spelled wrong. Sorry about that. So there are a whole bunch of other food products that do contain GABA. What I could find is that these, so brown rice, that's supposed to be spinach, beans, potatoes, sweet potatoes, yams, these all have a significant amount of GABA. There are a couple different platforms online that are promoting the use of foods as medicine. I'm a pharmacist. I'm not opposed to that. I think as long as you have a dietitian involved and you're getting everything you need, that's fine. But I thought it was really fascinating because a number of the groups that really were focused on assisting with pain and muscle spasticity, as well as anxiety, stress, coping, and insomnia, included a large number of these food products. And it struck me that even though they may be going down a natural dietary route to treat their condition, it may actually be much more pharmacologically related than what they had originally intended. So I wondered, why did we not develop a GABA product as a prescription? There was research that started back in the 1940s and the 1950s. And what they originally found was that they didn't believe that GABA could cross the blood-brain barrier. So the blood-brain barrier being that barrier between the blood vessels and the central nervous system that everything needs to pass through. In individuals who are healthy, that tends to be really tight junctures where they don't allow a lot of things to go through. The initial studies were done primarily in animal models, and they used some GABA, but they used some of the variants of GABA that were a little bit more stable in the different media that they had them in. So some of them were alcohol-based because they were in water type solutions. And they found that they were not getting, when they injected the animals, they were not getting a lot of increase in GABA in the brain. So they didn't believe that GABA could be given orally and then absorbed and go into the brain. Since then, there have been a number of different GABA type products that had come out, and there were a couple different case series that looked at post-mortem evaluations of patients who had been taking some of the products. So they weren't just GABA specific supplements, but usually a combination of other things. And what they were finding was when they measured concentrations, they were finding more GABA in the brains of these deceased individuals than what they had originally anticipated. So they started looking and wondering, is GABA actually able to be administered orally and absorbed and be able to act in the brain? They've identified what they believe is a GABA transporter that will transport GABA from the blood vessels across the blood-brain barrier. The next step is that they're starting to look at indirect markers to be able to extrapolate whether or not we're getting increases in GABA. They're doing this by looking at a few different things. So some of the studies were looking at EEG readings. So they were looking at the number of alpha waves. So if they have changes in the alpha waves that are related to the concentrations of GABA, they're then saying, well, if we gave you GABA and the alpha waves change, that could be indicative of increased GABA concentrations. They're looking at inflammatory markers, a number of different immunoglobulins. They've tried to do some radio labeling, although they haven't been incredibly successful, and most of them have been done in animal studies. So still to be determined, but it does appear that oral administration of GABA can result in some increase in GABA concentration centrally, which is likely how the supplements have been able to proliferate quite a bit, is because there is some effect. I am very much an evidence-based person, and I really tried to find what evidence can I find specifically on the supplements. There is not a lot. There is a proliferation of anecdotal reports that the supplements help improve sleep, help improve people getting to sleep, help improve people staying asleep. Not as much for the early morning awakenings, but definitely for the other two. There's a lot looking at stress, perceived stress, helping with mood, helping with anxiety, as well as in individuals, especially with chronic pain, that say that they're having less issues with muscle spasticity and pain when they do use these supplements. There are a few smaller controlled trials. Most of them are using doses of 100 milligrams of GABA supplements or less, which is way less than what the supplements that are currently available. So it's really hard to be able to generalize and say, okay, so this data can be achieved with these same products. So I did struggle. The controlled trials that I found tended to be less than 50 individuals, and they weren't looking at specific outcomes. So they weren't measuring their sleep changes. They weren't measuring anxiety rating scales. It was much more indirect type things. And in most of the anxiety trials, they were actually looking at changes in blood pressure and heart rate. So these were the best ones that I was able to turn up. The first is an 8-week-long controlled trial, and they took patients that had adult patients that had anxiety or high stress, and they randomized them to 2 groups. So one group got low dose GABA that was formulated in an oolong tea, and the other high dose group was 2 milligrams of GABA that was in the oolong tea. And the thought was the low dose group is essentially the control because they shouldn't be getting anything from that. They looked at the outcome of heart rate variability in the average resting heart rates or the average RR interval on EKG, as well as resting heart rate for the patients. So they were trying to look at this in terms of a physiological marker of anxiety and stress in the patients. They looked at improvement versus baseline, and they did see that the higher dose group had improvement, although they didn't give specific numbers for how much that change had improved. The other thing that was mentioned was if an individual has more of a relaxing type behavior, so if you make yourself a cup of tea and sit somewhere quietly and have it, is this a result of just the supplement, or is this a result of having those couple minutes of just something relaxing, like making yourself a cup of tea and having a couple quiet minutes? So it really wasn't clear that the benefit was just due to the GABA itself. So I was unsatisfied with those results. 8-week controlled trial. So this was looking at 16.8 milligrams of GABA supplement daily or placebo. And this was in adult patients that were complaining of insomnia. And they found improvement in their feelings upon awakening. So they felt better when they woke up. But when this trial actually looked at a couple different, like the Pittsburgh Sleep Quality Index, and they didn't see any different, or they said they didn't see any differences. The numbers weren't reported. So they didn't find any changes on those actual objective scales. To be fair, this was a relatively small number. It was about 20 patients. So maybe the patients felt better, but it wasn't clear that their sleep quality had actually improved. The last one was a 3-week intervention that used 100 milligrams of GABA, so a little bit higher dose, and they did see improvement in sleep parameters. So a little bit counter to that first one, in the short-term trial, when they looked at the Pittsburgh sleep quality, they saw a decreased time to going to sleep as well as an increased sleep duration. So they did see a little bit inconsistent results there. So maybe there's an effect, but is this all good news? So there really weren't a lot of adverse effects that were reported. I came across this report. So this particular product, the beta-phenyl gamma aminobutyric acid, goes under a number of other names of products that have been marketed. This is the product that I had mentioned that was studied in Russia. So it was developed in the 1950s in Russia, and it was developed as a cognitive enhancer. It's marketed currently as an amino acid dietary supplement, and it's really closely related to baclofen. It actually looks like a prodrug of baclofen. They've been promoting its benefit to help as an anxiety reliever, cognitive enhancer, mood enhancer, as well as a sleep aid. But with this particular product, they've actually had a number of different reports because it rolled out in Russia and then in Europe, and it is available online here in the United States. And there was a review that was done that was able to compile a number of different it wasn't Poison Control Center because most of them were done overseas in other countries, but reports of toxicity. And they found a large number of reports of intoxication at doses of 2,000 milligrams or more. And then in patients who are using this on a regular basis at doses above 100 milligrams, there were a number of reports of withdrawal symptoms. And this could be from agitation and insomnia, potentially some gastrointestinal effects. They didn't report any seizures, which was what I was specifically looking for. But they also had a number of reports of misuse where individuals were using excessive amounts of this particular supplement and causing intoxication and doing it on a chronic basis. Its supply is not restricted at this point. There were no registries or anything that would require the monitoring. So I just thought it was interesting. This was the one that was highlighted that, yes, it may be beneficial for some of these indications. We don't have a ton of efficacy data, but from a side effect standpoint, it may potentially cause some adverse effects that are of concern and maybe an agent that could be misused in some individuals. So in summary, GABA supplements are way more widely available than what I was aware of. There are a ton of different formulations. There are sprinkles and powders and chewables and orally dissolving tablets and liquids and all kinds of formulations, as well as regular tablets and capsules. The evidence on the efficacy is really inconsistent. Stress and sleep changes are the ones that we have more evidence on, but we really need some additional data to be able to evaluate really how effective this is, as well as who might be a good population for this. And there is a potential on the safety side for intoxication and misuse. While this might be dose related, we do need some additional information. So like most of the other drugs, it's not going to be just something we could use without any type of consequences. So with that, this was a fascinating area. I found things I wasn't anticipating, and didn't find some of the stuff I was hoping to see, but I will turn it back over to you.